Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, let me ask you something. Have you ever wondered what kind of doctor you will become in the future? Okay, imagine you are a young doctor and your consultant is responsible for handling a case but you really don't know what to do. After that, you start to wonder if you are incompetent. You start to think that maybe during college your way of studying was not right or that your goals were wrong. But that can't happen to us, great medical students, because on this occasion I will state the two main reasons why medical students should be competent from now on. First, there are only a few competent doctors in Indonesia. Second, there is a gap in the quality of doctor graduates. At the end of my speech, I will summarize what I have said before and make some suggestions. Okay, the first reason why medical students should be competent from now on is that there are only a few competent doctors in Indonesia. This is because during college, medical students are more focused on the test scores, so that many doctors who are smart but less skilled. Based on the statistical data which is taken from the Ministry of Education and Culture, in August 2021, only 597 people passed UKM-PPD and 1,022 people didn't. We all know that UKM-PPD is a competency test held by the state for prospective Indonesian doctors. UKM-PPD consists of the two tests, namely computer-based test and objective structured clinical examination or doctor and patient role play test. I know that both of them is not easy, but keep in mind that the quality of the doctor is not directly proportional to the scores produced. This doesn't mean that smart doctors will be more skilled at treating patients. Based on my experience, this is what we face nowadays. Based on my experience, this is what we face nowadays. Usually, we always focus on the test scores. Sometimes we feel like, what if my score is bad? I'm afraid if I don't pass. I'm lazy if I have to repeat. Isn't that right? I'm still do that sometimes too. Therefore, this is what we must to change. No longer about the test scores, but about improving skills. The skills referred into this case are not only skills in taking actions, but also communication skills with patients and skills in educating patients. We can practice this with anyone. It can be parents, siblings, or neighbors. When they complain about some things, we can help a little according what we understand. Besides developing skills, of course our knowledge will also grow. Okay, next, the second reason why medical students should be competent from now on is that there is a gap in the quality of the doctor graduates. This is because there are many assumptions from the community when their child doesn't enter the selection of their favorite faculty of medicine, but they really want their child to become a doctor. Often parents choose any faculty of medicine as long as they accept it. However, will the quality of the education be the same in one education center as in another? Based on the article that I have read, out of 75 medical faculties, both public and private, have a large quality gap, most of which are still accredited C. This means that most of them still have difficulty in doctor's competency exam. Even if they repeat the exam many times, they still don't pass. Those who never pass the exam because they don't have enough ability to become a doctor. Therefore, this is what we have to change. No longer about the institutions influences the quality of the doctors produced, but back to the personality of the prospective doctors themselves. In conclusion, medical students should improve their skills. This is because Indonesia still needs more competent doctors. Moreover, to improve the quality of the medical education in order to produce qualified doctor graduates. Therefore, I like to recommend that medical students must force themselves to study independently with high curiosity. Why? Because the basic of knowledge and skills is the desire to know. I think that's all from me. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.